Hi, I'm Christina Bausch. I'm a physical therapist here at Rebound Physical Therapy in Topeka, Kansas, and I specialize in pelvic floor and women's health therapy. So today I wanted to talk about how physical therapy can help women who are experiencing frequent UTIs. So first of all, let's just talk about what a UTI is. So basically that stands for urinary tract infection, which can mean that there's infection in any part of that urinary tract, which can be the bladder, or if it gets more severe and it spreads, it can go up into the kidneys. And that can be more of a severe problem. So some of the symptoms of a UTI may be painful urination or a burning sensation when you urinate. It may be pain just in the lower abdominal or pelvic region. If those symptoms are spreading up into your kidneys, you may be experiencing some low back pain. You may be having the frequent need to urinate with just a small amount, avoiding each time. You may notice some cloudiness of your urine, maybe some blood in the urine potentially, or an odor to the urine. So if you're experiencing any of those symptoms, definitely follow up with your primary care medical provider, get tested, see if there is infection there, and of course treat that as needed. So your doctor may prescribe an antibiotic or something like that to help you get over that infection. So women are more prone to urinary tract infections because we have a shorter urethra. So that distance between the outside world and our bladder is shorter than in men. So that makes us more prone. We also have less distance between that urethral opening and the anal opening. So there's more chances of cross-contamination there, which can lead to infection. So when we talk about how physical therapy can help with treating chronic urinary tract infections, there could be some different underlying reasons. So one of the reasons may be because the bladder isn't emptying completely. So it's normal when you empty your bladder that there's going to be a little bit left in the bladder, but it shouldn't be a large amount. So if the bladder's not emptying completely, more urine staying in there, it kind of creates a perfect environment for bacteria to breed, and that can lead to more frequent UTIs. So in physical therapy, one of the things that we can do is to get to that root of why isn't your bladder emptying. So for some women, it may be that the muscles of the pelvic floor that are that support from the underside of the bladder may not be relaxing like they should when you want to empty your bladder. So we want those muscles, when you want to empty, to shut off, relax, let everything pass through. But in some cases, those muscles may be over tense. They may not be able to relax well, and so that leads to the bladder not emptying as completely as it should. So we can definitely work on things in therapy to help get those muscles where they will relax normally, and that will help get to that root cause of why you're experiencing infections. Another scenario that also the bladder's not emptying completely, but it's kind of a different reason. So sometimes the bladder will actually fall or tilt, so you may be experiencing some prolapse symptoms. And so in that case, the bladder's not in the ideal position, so some urine kind of gets trapped in there and it may not empty out completely. And so in that case, we're going to look at, of course, what's going on, but a lot of times that may involve more strengthening and supporting that pelvic floor to help get the bladder up into a better position, so then you're able to empty more completely. And on the other side of things, it may be that you're experiencing some bowel incontinence or even just a small amount, and that can be for different reasons. It could be that the muscles are too weak, so they're maybe allowing a little bit of leakage throughout the day, or with some urgency of stool, and then we get some cross-contamination there. It could also be that maybe you're on the other side of things, maybe you're having difficulty emptying completely, and there's reasons there that maybe there's a little bit of contamination as well. So we can work on it from either end, both either strengthening the muscles or helping muscles that are too tight to relax, so that you're both able to empty your bladder and bowel well. There is another scenario of you may be experiencing UTI symptoms, but you're actually not having infection. So it could be you feel like you have a UTI, but you go to the doctor and they check and there's not actually an active infection present. So we can help with those symptoms too. It may be that the muscles are creating some of those symptoms. We can definitely get to the root of that. So if you're experiencing any urinary tract symptoms, if you're having frequent UTIs, Definitely follow up with your doctor, but at the same time, it would be a great idea to check into some physical therapy. I think it definitely could be a good option to hopefully get you to the root cause of why you're experiencing that infection and help to reduce that and help you have a better quality of life. So definitely, if you're experiencing these symptoms or if you're having questions, I would love to sit down and talk with you. Just let me know and we can visit and come up with a plan to help get you over your symptoms.